And now we'd start our official meeting. If you'll join me with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. I now declare this meeting of April the 8th, 2020 duly open, and we will start right with our agenda. B, approval of regular session minutes. Board, I know you've had these minutes in advance, had an opportunity to review them. Do I have a motion to approve the minutes of April 1st, 2020?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy?
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. In an effort of time and efficiency, I'm going to move item G up to this portion of the schedule for county staff and elected official discussions. Do we have any county staff this morning, Tom, that would like to address the board?
Julianne Nesbitt is online with us.
Thank you. Hey, Julianne.
Good morning, everyone. So I just wanted to provide a brief update on where we're at with our COVID-19 response. So as of this morning on it, Clermont County Public Health, we actually had 24 cases. We currently have 6 hospitalizations, 1 death, and then 15 of our cases have resolved. That information is available on our website. It gets updated at around 2 o'clock daily with it. So I do encourage people to go to our website. It's ccphohio.org, and they can get those case count numbers themselves for that information on it. Just one note as to, we've had issues over the last couple of days where numbers have gone up higher and then they've come back down the next day. We did put a bit of an explanation on our website and out on social media. Sometimes that occurs because when incomplete records are put into the Ohio Disease Reporting System, it may come back to an old address where somebody hasn't maybe updated their healthcare record. It may also be if they don't have an adequate address, it may instead the address of the facility may be taken, or a healthcare provider, or a lab that may be within the county somewhere. So when those cases come in, we do a thorough investigation of those, and if they are not our residents, they end up getting transferred out to another health department where those individuals actually live. So that's why you may see one day our numbers up. It takes us some time to be able to call, get a hold of people, figure out where they really are truly living at, and we work through those individually. So that's why you may see some fluctuations in our numbers from day to day to just explain that. The additional thing I would like to share with everyone with the stay-at-home order is we have kind of a new process put in place for individuals to file complaints on the stay-at-home order. On it, again, if you go to our website at ccphohio.org, those can be filed online. We do really encourage people, please read the stay-at-home order first, and make sure that the question you're asking or what you're doing is really a legitimate complaint on that. You can file the complaint online then. We need to have a business name and a business address to be able to go further investigate those, so that information can be put in online. And then we will work through investigating those. Some of our staff actually, some of them will reach out via phone call, some of our staff will go investigate some of those, and then local law enforcement is assisting us in doing some of those investigations also. And then we'll kind of go from there, whether or not, if it is just deemed as an essential business, we will make sure that they are doing the social distancing requirements that they're supposed to be doing. So kind of a new way of doing that to hopefully streamline things a little bit. We do get sometimes multiple complaints on the same facility with that, and we try to kind of take all of those into consideration as we move through and look at those. So that's all I have at this time, unless commissioners, you have any additional questions for me.
Julianne, just maybe a clarification. There seems to be a lot of information out as far as projection of the peak that Clermont County would when this virus would actually peak as far as cases in Clermont County. And I know no one has a crystal ball, and I'm sure you don't either. What's your best information that's available right now, just to kind of offset, maybe some false information or maybe some not reliable projections?
I think that's a really good question, and it's one even we struggle with to try to really figure out where we're at. We still have the issue with not everyone is being tested, so it's difficult to see where we're at in that curve. With it, I don't think we are there yet. We're still, I think, on the uphill climb. With that, there's Ohio additionally, Ohio Department of Health is working on some additional information coming out on modeling. I do encourage people to watch the governor's press conference. If you can't do it during the day, then certainly you can review it at night, because they discuss a lot of the modeling that is going on. And really we're using what data we have to make some guess estimates. And it's true, nobody has a crystal ball. We wish we did. We wish we could tell the public everything, that we know the exact date it's going to peak and that it'll go down from there. But we just don't have that type of information. It's a new virus. It's new to us. We are looking, at what happened in other places, in the world and then in the country also, to kind of see how they have escalated up that curve, what measures they've taken and put in place. Are they starting to flatline a little bit? And then I think we're going to see, as we start to kind of slide back down the curve on the other side, it is not going to be an immediate life is back to normal. As we start to proceed down, the idea is the state would slowly be kind of removing some of those restrictions, and they're going to remove some of them, and we're going to wait and see what happens, because we don't want a second spike to come up. Obviously we want out of this as quickly as everybody else does. I do too. I would like to go back to some semblance of, I don't know what normal is going to be in the future, but it would be lovely. The sooner we can get there, the better with it. But I just don't think we have a crystal ball. So I don't think we're there yet. We are not at the peak of our curve yet. I think we're going to wait and see over the next couple weeks where we end up going, and that data will help give us better predictions.
And then just a question on a couple things there. PPE availability, how is that going? Those seem to be, highlights throughout the United States as people report on this. The other thing is ventilators, hospital space. Could you touch on that a second?
Yeah, so, as far as PPE is an issue. We are fully aware that there are individuals who can't get the amount of PPE that they need on it. So the PPE that came down from the Strategic National Stockpile has been dispensed out to hospitals, first responders, long-term healthcare entities. The donations drive that we took in, we have also dipped into those stockpiles to give entities that are in need of PPE some things that they need. It's not everything. We are not going to be able to meet their need. There is a stress that they have to be using PPE conservation measures, and there's a lot of guidance and information out there on that, as well as we encourage them to continue to try to source their own PPE through various routes that they may have. But we know that that's a concern. It's a concern for us because we don't want healthcare workers or people having to do their jobs unprotected with it. I think that with the new technologies that are happening with Battelle, and I think we're going to continue to see more and more things come online to help sterilize and kind of recycle PPE. The hope is that we will be able to meet the demand here in the next couple weeks. As far as ventilators, I think hospitals are doing a fantastic job of pulling in vents that may have been used in other locations. So, outpatient surgery sites, other things where ventilators may be, they are really doing their best to pull those in. And so we will be able to meet capacity. The state is doing a lot with being able to try to track ventilators so that if an area is hit particularly harder, they may be able to move or transfer ventilators from one region to another. With it, and the same with our hospitals, they are doing a fantastic job of trying to build out surge within their own walls. And then additionally, they are working to see how we can, how the healthcare systems can kind of come together and run, an alternate care site. So I think there's lots of still planning and information going out there. The hope is, I think we all hope and pray that we don't necessarily need it. If we can contain surge within the four walls of hospitals, that makes life easier for everyone, but realistically, we know that may not happen. So I think we have to and be prepared for it.
And then with Tom here, I just wanted to reach out. I know with the sanitizer shortage that we had here in Clermont County, I just want to mention Wade Grablowski and his efforts. If you'd just like to touch on that a minute. One of the things, I talked to some people from CCAO yesterday. They were very, very surprised that a county agency would be in the manufacturing business to actually produce sanitizer.
Yeah, Wade has been doing that, I think, now for probably almost a week, right, Julianne? I think he's been making our own sanitizer. He's got the formula, so he's been dispensing that out to agencies that need it.
I think that's very noteworthy. I mean, that just shows that, the people that make up our staff here in Clermont County are innovative in their approach, that they would actually go out instead of, waiting and seeing a shortage, finding a way that they could fill that gap and then starting the manufacturing process. So I just wanted to say, thanks for your leadership, Tom. Thanks for Wade's hard work and his team and whoever else is working on that. So
And I'll pass that along to him.
you bet. Anything else, Julianne?
Nope, that's all I have.
Hey, thanks so much for taking the time out of your busy day. I know you're covered up for meetings, and believe me, I understand you want to lose this particular management item as quickly as possible, and so do all of us. But, I wanted to make sure we had a conversation and a discussion today that people shouldn't let their guard down yet, even if they're hearing some conflicting information, that, it's not believed that we have spiked to the point that we're going to see yet, and we should stay diligent in those efforts. Is that a good take on that?
It is, and I would really stress that. I think we are doing, a good job of trying to, reduce impacts. People who are abiding by the stay-at-home order, I personally just want to say thank you because it is making a difference. But again, I think the thing we need to reiterate is what we're doing now makes a difference 2 weeks from now. So if things look okay for right now and people aren't, we can't just let it go because it's really what's going to happen 2 weeks from now. So people, if they're not abiding by the orders and they're out and about in public, those are going to be the cases we're going to see 2 weeks from now on it. So people do need to, stay strong, stay diligent on it, continue to abide by those stay-at-home orders. We are making a difference. I think we're going to see Ohio, Clermont County and Ohio come out of this hopefully maybe better than others. We'll just wait to see if the measures that we're taking are really going to have an impact. But I truly believe they are having an impact and it is going to make a difference.
And I believe that. I think everyone's management of this particular this incident, although you can't plan too much in advance for a virus, there were plans in place for a crisis such as this in Clermont County. So it wasn't something that hadn't been contemplated or hadn't been thought of before. Thanks, Julianne.
Thank you.
You bet. Board, any other questions for Julianne this morning? Tom, who else would like to talk to the board this morning?
So we created a COVID-19 finance committee through EMA.
Okay.
So Greg Bickford is leading up that charge. So Greg is going to give the board an update on what they've been working on.
Commissioners, good to finally be here in front of you.
Greg, good to
about
have
a month.
you here in front of us.
Just to give you a quick update, so we have this finance committee. We're going.
And before you start moving, tell the people who are watching who you are and what position you have here.
My name is Greg Bickford, new Assistant County Administrator. Been here for about a month now. Maybe this is my 9th day in the office, maybe. I don't know. So, yeah, we've been working hard on not only the COVID-19 stuff, but there's still county business still going on. We've got economic development moving. We've got building permits moving. So we are doing our best to keep up with these challenging times. The Finance Committee was created a few days ago to try to figure out the best way to source materials, try to find all the grants available. Sherry Smart is going to talk to us later today about HUD and some of the CDBG funding we received, so we'll get information and guidance on that. But the goal of this Finance Committee is to kind of be a clearinghouse to find out what types of equipment we can procure, whether it's PPE, whether it's sanitization supplies, whatever it may be. We're kind of a clearinghouse for all the partner jurisdictions with the county. So we, the first task that we have is Battelle. We have a contract with them. In fact, I just got an email from prosecutor's office. It looks like we have an agreement we're ready to sign, and so that should be in place. We'll be able to sanitize N95 masks. So that should hopefully be rolling out in the next couple of days to our partner agencies. Other than that, we're on the hunt for any funding we can get to reimburse ourselves for all the expenses we have, and hopefully we'll come up with some good ideas here shortly to minimize the impact to county revenues.
And just to talk about that, I have received a letter to that effect that, those grants have been approved through the Department of Urban Housing and in the form of a CDBG grant. And there is a plan owed to them as to what we will expect to be spending that money on. So,
Correct.
my hat's off to you and to Sherry Seymour for, a diligent approach on that. I don't know if we're the first ones ever to receive a letter that, but we have to be way up front when it comes to that.
And we're one of the first.
I'm not going to take credit. I'm not going to, make any suggestion that we're first, because that may be totally wrong. But I know that we're definitely up front. No question about that.
We are, and we're one of the first local governments to get a contract with Patel. So hopefully that will pay dividends for us here in the future.
Greg?
Yes, sir.
Can you tell us what groups within the Clermont County need those kind of N95 masks refurbished?
Well, pretty much any.
JFS, I know.
Yeah, JFS, CTC, even building department, everybody within the county that has dealings with the public is going to need that type of mask. It's recommended, so we're doing the best we can to get that distributed, as well as our law enforcement partners, first responder partners. Julianne's been instrumental in working with Pam Haverkost to get just a kind of a needs assessment of what we need and what we can try to procure. So there's a lot of people that are affected by these masks.
And I understand that our safety department has sent out a safety bulletin to our employees as far as the risk and the hazards of COVID-19.
That's correct. Gary Caudle has trained the employees. We now have guidance on how to properly install and fit a mask, how to make sure you don't cross-contaminate it. Just everything from the daily office operations has all been dealt with, so we're making sure we're as safe as possible here.
Fantastic.
So the Battelle contract is going to be under my purview because it's under $50,000. So that was one of the things we had to work out, was that not to exceed amount. So once we sign that contract, we'll be able to proceed with Battelle. I think the fire safety, the Fire Chiefs Association, I think they signed their own separate contract, but they'll probably piggyback on our contract later. So we'll be ready to go.
Okay.
What I heard was each department is planning to have their own contract.
Yeah, that's
Each EMS department?
Yeah, that's not my understanding. My understanding is that the fire chiefs went ahead and did it, but the rest of the agencies are waiting for us, and they're going to coordinate through us. And that's what the MOUs will be about, is making sure we all have MOUs with those agencies for reimbursement purposes.
Okay.
And that goes beyond the mask. That's anything that the county distributes. There will be MOUs in place because FEMA has set up reimbursement to the local jurisdictions, but we're also working on reimbursement to the county as well for whatever we may give out.
Right. So it includes all the supplies, as well as the masks, as well as any of the face shields that come in, anything that we're purchasing and distributing. And so we've tracked all that already. So it's not we knew that from the beginning. So we have spreadsheets. We're tracking all that equipment that we're sending out. So we'll have the documentation.
And it's noteworthy to talk about the Patel Laboratories. This is a particular innovative approach that they're doing for the sterilization of N95 masks. N95 masks are typically worn and thrown away. Some hospitals autoclave them 4 times before they're thrown away. And I don't know that that's a norm. I'm not suggesting that that's a norm. But Battelle is able to sanitize these particular masks. The silicone and the rubber mask and all those have been sanitized for years and years, and there's known procedures in how to do that. This portion on the N95 is definitely a new innovative approach to try to stretch that PPE and make it available. One of the things to talk about on that is that from the meetings that we have in the morning, one of the things that came up was people sent those N95s up to Battelle and ended up only getting 50% of them back. People need to understand, if you're going to wear those N95 masks and you're going to utilize them, you can't utilize them with things like facial makeup. If you get those kind of contaminants onto that mask, they will not sanitize that mask. They will pitch it. is what they will do. So, got to get the word out to people that, if you are aware of particular makeup, eyes only, nothing on the face. Obviously, if you're going to wear a respirator, clean shaven, you can't wear a respirator effectively with a full beard on either. I think that's a very obvious thing, but it's always when people start down that road, there are always those that don't really consider that. So,
And Gary Patel is training on that.
okay, good. Great.
That's all I have.
Thank you.
Thank you.
Do you want to, I'll get Sherry. Yeah, do you want the CDBG update right now?
That'd be great.
Okay.
That'd be great. Why not? Why not?
Okay.
Good morning.
Morning, Sherry. How are you?
I'm good. I'm Sherry Smar, Community and Economic Development. And I just want to give you an update on what's going on with the CARES Act grant and the funding through CDBG. There's very little that we know and a whole lot that we don't know. We know that we have been given our 2020 normal allocation for CDBG, and that amount is $974,086. It's actually less than a 1% reduction from last year. The CARES Act, Clermont County was given $573,028. Okay. What we know about the CDBG grant is that HUD has lifted the 15% requirement for public services, so we don't have to stay under 15%. And they have allowed communities to be able to do a 5-day public comment period on any changes. They're allowing us to use this money for either 2019 funding or 2020 funding. So that's what we do know. HUD has released guidelines for their HOPWA grants, their ESG grants, and their Continuum Care grants. No guidelines have been released yet from HUD for CDBG, and they don't expect it to happen within the week.
Okay.
So we're still waiting to find out what we can or cannot use the money for. I'm moving forward in recommending to the commissioners that we do a substantial amendment to our 2019 annual action plan. The reasoning for this is if we do the substantial amendment for our 2019 annual action plan, which we've already had our request for release of funds released from HUD, if we say that at the time we are using this grant for emergency service gaps that will require applications or some form of process, which we haven't determined how we're going to do that yet, from agencies that need assistance for the COVID-19 from the CARES Act, then we can release funds that we already have, reallocate those funds for these services, and then when we receive the CARES Act money, which while we have the letters now, we have been informed that the money won't be released until the end of June. So we will use the money that we have on hand, and then the CARES Act money, when it comes in, will supplement the programs that we have already agreed to fund that are going through environmentals right now, so they have not been released yet. I've met virtually with our health district. This afternoon, I will be meeting with EMA about unmet needs. I've already reached out to Homeless Shelter Senior Services and the YWCA House of Peace because I've heard that there have been issues with them. The homeless shelter has had to house their residents in hotels right now to do the social distancing and to comply with the state's requirements. That is running them right now around $30,000 every 2 weeks. They thought that they were okay through that 2-week period, but we've extended. So they are requesting funds to help with the hotel and housing. Senior services, they have about 170 priority 1 clients, and they break their clients up by priority 1, priority 2, priority 3. Priority 1 clients are seniors who have no family or no surviving members to take care of them. So they are on their own. They have sent them 14-day shelf staple boxes, which are almost gone. They would like to send them more. They have an additional 53 clients now requesting Meals on Wheels because of COVID-19. And I believe that I received a letter from them today requesting assistance with meals through the end of April for their seniors. And then YWCA House of Peace, of course, is our battered women's shelter, and they are requesting assistance because they have also had to find alternative housing for their clients due to the social distancing. And I believe that they said they had 1 family and 11 clients. So these are 12 separate housing assistances that they'll need. So this is just what's been brought to our attention at this point. By saying that we're going to use the funds for gaps in social services, we could help and assist these as they come in. I also know that Department of Health was requesting assistance with purchasing of thermometers because you cannot believe how many people do not have thermometers in their homes. And that's part of the social distancing and the stay-at-home order is taking your temperatures daily and things like that. And I know that they said that they're purchasing them on a weekly basis as they come in because nobody has thermometers right now. So, anyways, my recommendation to this board is to forgo our 30-day comment period on the COVID-19 funds, do a substantial amendment to our 2019 annual action plan, adding the COVID funds in it. And at that point, once HUD receives that, I do not know what their approval process is. I know they're doing expedited approvals because normally it was a 30-day comment period or review period at HUD, and I know that they've changed that, but they haven't said what it is. With that, HUD states that we have to send them a waiver and give them a 2-day notice prior to the waiver. We still have to publish it in a paper, a local paper, that we're going to do this with these funds. We're requesting the waiver. You have 5 days to comment. After the end of the 5-day period, we would then have to come to the board with a resolution that this is what we're doing with our 2019 annual action plan. If the board chooses to go ahead with that, what the timeline looks like is we would have the waiver to HUD by Tuesday, or by Friday, I apologize. We can only publish next Thursday in the local paper because we won't have it in time from HUD. And then the resolution would come before the board on the 22nd, April 22nd session. And if you have questions, I did not cover half of what I know or what there is. But, you know, if you have questions, I could try to answer them to the best of my ability.
Any questions, board? Sherry, thanks for staying on top of this. I know it's fast and furious, and it's such a worthy effort.
It feels
for
good to
what's
help the
needed.
community. It really does.
We appreciate having you and you being right in the middle of it. Thank you so much for coming over today.
And thank you for keeping us fired up on coffee every morning.
I believe Ed had a question.
Ed?
No, I was just thanking her for what she's doing.
Oh, you're welcome.
Do you need any type of action from the board today on your recommendation to move forward with the 2019
I just need to know if the board, approves with moving forward. I will do a memo to all of you on how this process goes. But if you tell me, yes, let's move forward with a substantial amendment to our 2019 rather than including this in our 2020, and I will tell you why I don't want to include it in our 2020. Our 2020 annual action plan is also our 2020-2024 consolidated action plan. We will not be submitting that for approval by the board until July, so that's holding these funds up even further. So a substantial amendment to our 2019 plan in order to get the money out to the community is, the most expedient way to go about this.
I don't think we need a resolution for that. We're just looking for a consensus that proceeding in the direction.
I just want to know, could we
I would-
proceed forward with this resolution so that we could bring it before the board on the 22nd? Is this what we want to do?
That's fine as far as I am concerned. You bet. Claire?
Yes.
Ed?
Yep, I agree.
Okay.
All right,
Good thought.
thank you very much.
Thanks, Sherry. What else, Tom?
We have nothing further under staff comments.
Okay. And I would think, for the board, while we're understaffed comments, it's probably worthwhile talking about one of the things that, we want to make sure we don't overlook. And, this COVID-19 is a great time for us to evaluate finances, not only as a government entity or a village or a city or a township, but also as a county. As we're worrying about our family's health due to the COVID-19 pandemic, we shouldn't overlook our finances during this difficult time. With reduced consumer revenue and reduced business revenue and reduced personal income due to job reductions, impacts to local governments need to be considered also. And board, I would ask each of you to be thinking about that. As you may or may not know, we're projecting about a $7.1 million reduction in sales tax due to COVID-19 restrictions. And that can only be expected as Clermont County citizens are staying home and conserving their resources and protecting their health and their families. We must be careful not to overlook other areas where reductions in revenue could further affect local governments, like casino revenues. The Office of Budget and Management in Ohio is projecting about a $252,000 loss in casino revenues based on just the 47 days of receipts that they have. The county engineer's office is expecting approximate losses of $115,000 per month. And that's due to reductions in motor vehicle gas taxes. Although dollar amounts haven't been projected, Clermont County Transportation Connection, you talked about that, Tom, as far as their PPE needs, has experienced about a 50% reduction in ridership. And hotel, motel, lodging taxes are also expected to be reduced. My point is that you must know where your revenue is generated, your actual expenses, and your accrued expenses to adequately project your annual revenues. This is financial management at home, in business, and in government. Yes, county government business can be managed like private business. And let's talk about Clermont County for a second. Clermont County is very fortunate due to conservative management throughout the years. Commissioners prior to us and the current 3 commissioners understand that our business is highly dependent on tax revenue to operate here. Therefore, adequate reserves are on hand to allow time for an evaluation of revenue and cost before making a final decision. Although these funds currently reserved were not saved specifically for offsetting a virus like COVID-19. The monies were saved due to potential losses of tax revenues. This is why local governments need to conservatively budget and manage within that budget, and when possible, build an adequate reserve to manage through unforeseen financial impacts that may arise. We have currently restricted non-essential travel, and we are limiting the hiring employees to only those essential positions that must be filled as we continue to evaluate the overall projections and time duration. The bottom line is, it's your money, and it's our money too. Clermont County is in a sound financial shape to manage the COVID-19 crisis. Our county will continue to serve you, but we need you to continue your efforts and keep your family and yourself safe. Thank you. Tom, anything else?
Yes, sir, I think you covered it. I mean, we're getting great cooperation from our department heads and elected officials. We send out a notice to them, to the elected officials as well, and I've gotten several phone calls, and they're all cooperating, doing their best to cut expenses when they can, making sure they review all their vacancies to see whether or not it's absolutely essential over the next 60 to 90 days. So all the communication is there, receiving great cooperation. Mary's going to update our projections, and we'll give those to you. I'll try to do those on a weekly basis. Mary, I think you had a projection come in today. Do you want to just talk a little bit about that? I think she had some casino revenue receipts came in.
Great.
Yeah, the casino revenues are reported to the state on the 8th. They're released to the counties. And last week, with the numbers that you were using, Mr. Painter, I had projected like a $2.5 million a day loss to the casinos. That trickles down to the counties. Well, those numbers came in about $2.4 million for the 13 days that they were open. So I'm still looking at our loss is about $7,500 per day that the casinos are closed. Because the state gets 33% of their gross revenues. Of that 33%, 51% comes to the counties, the 88 counties. And then our piece, based on population, is about 1.7% of that.
You know, and you're right on when it comes to that. You know, the thing that I would say, Mary, is thanks. I mean, it's obvious that you understand the cost. I mean, making a projection from a desk from what you see and the information that you have on hand and being within, you know, $100,000 is commendable, no doubt about that. You know, absolutely. And that's my point. My point is that, you know, we have prudent financial people here that understand what those costs are, and you understand where the revenues come from. And with that information, you know, you're able to project where we're going to be. Obviously, that's what reserve funds are for, and stabilization funds, and why counties do that. I know from my start here, I was made very aware that we're very dependent on sales tax, and that, you know, one of the things that we always talked about was that if we had a particular bad storm that took out some of our largest businesses in Clermont County, obviously we have a large sales tax reduction, and that's why we keep the kind of money that we have on hand.
Right.
I mean, there's always thoughts of reducing the amount of money on hand and using that throughout the county organizations, and then something like this comes up that shows that you really do need to have these kind of reserves on hand so that you can weather a storm like this.
It
you know.
reminds us, we have a target of keeping about 33% of our operating revenues as reserve. Right now, when I take out the dedicated revenues, dedicated balance for economic development and such that might be in there, we have just under 40%. So that frees up about a little over $4 million of our reserve balance that's cash on hand to cover us during these types of events. And then we have the $5.3 million, as you said, in the budget stabilization fund that was set up. Then with cooperation of the other departments, with our capital, we're looking at that because we put inside millage into the capital fund. So if need be, that's something that we're looking at. That's why we're tightening our belts on the capital to go from there. But the
You bet.
casinos is going to impact the state quite a bit because they're down about 60% from where they normally are.
You know, and that's the thing. Normally, I mean, people wouldn't look at the whole spectrum of all of that you know, and again, you know, I've always said that, you know, you can manage government business like, you know, private business, and this is an exact example of that. You know, if you understand where all your revenue comes from and where all your costs are, and you know what your accruals are, you know where you're going to be at the end. And so, you know, my hat's off to, I mean, this isn't something that started from the last 3 years this is something that Clermont County has done for years and years, always operated with a balanced budget. And this is where it all comes down to when you actually need it. So
We
so
couldn't have
thank
done
you.
it overnight.
You bet. Thanks for your diligent efforts. You bet. And for all the people here that, manage the budget here at Clermont County. Thanks. Anything else, Tom?
Yes, sir.
We will continue with the agenda. C, consent agenda. Board, I know you have a consent agenda that was provided for you in advance. You had the opportunity to review it and ask questions or have clarifications made. Are there any items that need to be removed from the consent agenda for further consideration?
None from here.
Claire?
None.
Hearing none, I would ask for a motion to approve the consent agenda as presented.
I'll make the motion.
Second,
It's been moved and received a second. Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
aye.
Mr. Painter.
Yes. D, the non-consent agenda starts on page 3 with item 7. It's a recommendation that the Board of County Commissioners adopt resolution number 051-20, resolving to approve payment to vendors in the amount of $1,642,579.05 as set forth in the BCC approval invoice report for checks dated April 8, 2020, BCC directed prepaid invoice reports, and/or the procurement card transaction report is presented by the Clermont County Auditor on 4/6/2020, and further authorizing the county auditor to issue warrants for the same pursuant to section 319.16 of the Ohio Revised Code. Do I have a motion to pay the bills?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item 8.
Morning, I'm Lyle Bloom, Director with the Water Resource Department, and item 8 is a recommendation not to proceed with the Palestine Road Water Protection Project located in Pierce Township due to the lack of support from property owners for the project, and authorize the Clermont County Water Resources Department to send notice to the owners of property affected by said project, advising them that the project is no longer active and declaring that all proceedings with respect to same are hereby discontinued. So we received a petition from property owners in August of 2018. It was signed by 13 property owners. We sent letters to all the property owners who benefited in November of 2018 and also on January of 2019, giving them estimated costs and asking for responses if they were in support or opposition to the project. Those responses, we looked at those two ways. There's many of the property owners all own multiple properties. We had 8 property owners representing 16 properties that were in support of the project. 10 property owners representing 34 properties that were opposed. 1 property owner with 2 properties abstained, and then we had no responses from 5 property owners representing 14 properties. So we had majority of the responses, the majority of the owners that responded were opposed, and they also represented a large majority of the property as well. So we're recommending not to proceed with the project.
Board, you've heard the reading of item number 8. Do I have a motion for approval?
I'll make the motion.
Second,
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
aye.
Mr. Painter.
Yes. Item number 9.
Morning.
Hi again, Sherry.
I have a recommendation of myself, Grants Coordinator, Department of Community and Economic Development, with the concurrence of Greg Bickford, Assistant County Administrator, to execute an administrative agreement by and between the Board of County Commissioners and the Board of Trustees of Monroe Township, located at 2828 State Route 222 in Bethel, Ohio, for funding in the amount of $112,946 for project number 2019-06 relative to the Monroe Township Fire Station number 32 Improvements Phase 1 project in concert with the Clermont County Community Development Block Grant Program for fiscal year 2019.
Board, you've heard the reading of item number 9. Do I have a motion for approval?
I'll make the
So
motion.
moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item 10.
Item number 10 is a recommendation of myself with the concurrence of Greg Bickford, Assistant County Administrator, to execute change order number 1 to the contract with Bearcat Construction, Inc., doing business as Gridiron Construction, located at 4455 Bethany Road, Mason, Ohio. Previously ratified by the Board of County Commissioners on September 18th, 2019 for project number 2016-04 relative to the City of Milford Riverside Park Improvements Project in concert with the Clermont County Community Development Block Grant Program for fiscal year 2016, which represents an increase in the amount of $2,420 for a total adjusted contract price to date of $121,185. For additions, deletions, and/or modifications. This is a project that's happening at Riverside Park in Milford, and it is just to add additional electric outlets for the project that's currently going on.
Board, you've heard the reading of item number 10. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Item 11.
Item 11 is a recommendation of myself with concurrence of Greg Bickford, Assistant County Administrator, to approve the request to advertise for bids for project number 2018-04 relative to the Franklin Township Fire and EMS Building Improvements Project in concert with the CDBG program for fiscal year 2018, pursuant to plans and specifications therefore, and to authorize the clerk of the board to place a legal notice in the newspaper of general circulation on April 16th, with bids to be received until 2 p.m. local time on Thursday, May 7th, in the office of Board of County Commissioners located at 101 East Main Street, Batavia, Ohio, where they will be publicly opened and read aloud shortly thereafter. This notice will be posted on the county's website.
Board, you've heard the reading of item number 11. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item 12.
Item 12 is a recommendation of myself with the concurrence of Greg Bickford, Assistant County Administrator, to approve the request to advertise for bids for project number 2018-02 relative to the Tate Township Fire Department Parking Lot Improvements Project in concert with the CDBG program for fiscal year 2018, pursuant to the plans and specifications therefore, and to authorize the clerk of the board to place legal notice in a newspaper of general circulation on April 16th, 2020, with bids to be received until 2 p.m. local time on May 7th, 2020, in the office of the Board of County Commissioners located at 101 East Main Street, Batavia, where they will be publicly opened and read aloud shortly thereafter. This notice will be posted on the county's website as well.
Board, you've heard the reading of item number 12. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Thank you, Sherry. Item number 13.
Item 13 is a recommendation to accept the following grant assignment of permanent and existing right-of-way easements previously granted to convey to the Clermont County Transportation Improvement District for roadway purposes necessary for the Deerfield Road Site Distance Project located within Miami Township, pursuant to and in compliance with resolution number 2020-04 ratified by the Clermont County Transportation Improvement District Board of Trustees on 3/13/2020. This is related to parcel number 184332B-011.
Board, you've heard the reading of item number 13. Do I have a motion for approval?
I'll make the
So
motion.
moved.
I'll second.
Sorry.
That's all
It's all
right.
right.
I'll second it.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item number 14.
14 is a recommendation to, 1, accept the following grant and assignment of permanent right-of-way easements previously granted and conveyed to the Clermont County Transportation Improvement District for roadway purposes necessary for project number 90230 relative to the Half Acre Road and 276 roadway improvements project located in Williamsburg Township. And 2, to acknowledge that any and all compensation relative to the following easements has been satisfied by the Clermont County Transportation Improvement District pursuant to and in compliance with resolution number 2019-15 ratified by the Clermont County Transportation Improvement District Board of Trustees on 9/13/2019. There are 2 parcels related to that turn lane improvement project that are listed there.
Board, you've heard the reading of item number 14. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item 15.
Item 15 is a recommendation to accept the following grants and assignments of storm sewer easements heretofore granted and conveyed to the Board of County Commissioners, Clermont County, Ohio, in and as it relates to the Miami Trail Stormwater District in Miami Township, previously established and created as set forth in resolution number 144-15, adopted by the Board of County Commissioners on 9/16/15, and to authorize payment and compensation for the grants and assignments of storm sewer easements granted thereby relative thereto. There are 46 easements that are listed here. These are easements that were previously privately maintained, will be publicly maintained now as part of the stormwater district. This is just a portion of them. These have all been donated. I believe there have been a few other in advance of this, and there'll be others to follow.
Board, you've heard the reading of item number 15. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 16.
16 is a recommendation to 1, accept the following grant and assignment of permanent right-of-way easement previously granted and conveyed to the Clermont County Transportation Improvement District for roadway purposes necessary for project number 90520 relative to the Bristol Road Bridge Replacement Project located in Pierce Township. And 2, to acknowledge that any and all compensation relative to the following easement has been satisfied by the Clermont County Transportation Improvement District pursuant to and in compliance with resolution number 2020-03 ratified by the Clermont County Transportation Improvement District Board of Trustees on 3/13/20. There's 1 parcel involved that's listed there below.
Board, you've heard the reading of item number 16. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item 17.
I'll do item 17. It's a recommendation to accept a quitclaim deed previously granted and conveyed to the Clermont County TID for roadway purposes for the project that was the Eastgate North Frontage Road Improvement Project located in Union Township, and acknowledging that any and all compensation has been satisfied by the TID. These are for 3 small parcels that are on Eastgate North Frontage Road, as well as one of them is right at the intersection of Eastgate North and Eastgate Boulevard.
Board, you've heard the reading of item number 17. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item 18.
Item 18 is a recommendation to execute an agreement between the Board of County Commissioners and the Board of Trustees of Goshen Township relative to the Gaynor Road landslide project in Goshen Township with the engineer to pursue funding from the Ohio Public Works Commission in the form of a grant. The grant amount will be $347,750. It will reimburse 79% of the project, or $274,722.50. The required local match will then be $73,027.50, which will be paid by the county engineer and reimbursed by Goshen Township. And this is in compliance with the conditions set forth in the agreement.
Board, you've heard the reading of item number 18. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item 19.
Item 19 is a recommendation to authorize Jeremy Evans, county engineer, to execute, certify, and submit an application for financial assistance for the infrastructure improvements for project support for the following projects. This will be for program year 34 to Ohio Public Works Commission. The application will be required in compliance with Chapter 164. This will actually be for the 2020 landslide repair projects. There's 8 landslides across various townships in the county. OPWC grant funds requested are $914,781. The MV&G county road funds are $170,141.50. And then the Goshen Township, which we just did, will be the $73,027.50 for a total project cost of $1,157,950.
Board, you've heard the reading of item number 19. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item 20.
Item 20 will be a recommendation to accept permanent easements granted and conveyed to the county, and this is for roadway purposes related to the Lucas Road Bridge Replacement Project in Wayne Township, and to authorize the payment as compensation for those permanent easements and right-of-way granted thereby and repairs relative thereto. So there's 3 different properties listed with the compensation.
Board, you've heard the reading of item number 20. Do I have a motion for approval?
I'll make the motion.
Second.
Been moved and received a second. Any further? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number 21. Thanks, Suki.
Thank you.
Morning, Sandy.
Good morning. Item 21 is a recommendation of Yvonne Smith, Benefits Coordinator, with concurrence of myself, Sandy Tahat, Human Resource Administrator, to authorize David L. Painter, President of the Board, to execute a tuition assistance application submitted by Sarah Johnson of Clermont County Juvenile Court pursuant to Section 4.12 of the County Personnel Policy and Procedure Manual.
Board, you've heard the reading of item number 21 for tuition reimbursement for Sarah Johnson. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Thanks, Andy. Item 22.
Good morning again.
Morning.
Item 22 is a recommendation to renew the lease agreement with the Office of Educational Services for 9,798 square feet at the Family Support Center, the old Medical Social Services building, previously ratified by the board on June 6, 2018, and renewed on May 1st, 2019. And this is in accordance with the lease agreement, which is based on the CPI that's been replaced. It was a Cincinnati CPI, but the Department of Labor has changed that. The rate will be $13.20 per square foot for a total amount of $129, $333.60. So this is the second of 3 renewals pursuant to the lease.
Board, you've heard the reading of item number 22 for the renewal of a lease agreement with the Clermont County Educational Service Center. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes.
Thank you.
Thank you. That brings up the end of our current non-consent agenda. Tom, do we have any additions to the agenda for E?
Yes, we have 2 for the board's consideration. The first is a vehicle lease agreement with Clermont Animal Care Humane Society, and the second is an amendment to the county critical event policy.
Board, you've heard the request to add 2 items to the agenda. Do I have a motion to add those items to the agenda?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes.
We'll do the vehicle lease amendment first.
Okay.
That's a recommendation to execute Amendment 1 to the vehicle lease agreement between the board and Clermont Animal Care Humane Society for the lease of a 2015 Ford utility vehicle. And we've increased the amount to $1,125 and monthly installments of $125 commencing on April 8th, 2020 through December 31st, 2020. And also the lease of a 2014 Ford utility vehicle, and that amount is $843.84, monthly installments of $93.76, same term, April 8th, 2020 through December 31st, 2020. And this is because the Humane Society wanted to move up the lease to April 8th. It was originally May 1st, so we had to change the cost and the term.
Board, you've heard the recommendation for lease of vehicles to the Clermont County Humane Society. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Tom, this is part of our original lease agreement for the last year of the 3-year lease, correct?
Yeah, well, they used their own vehicles up to this time, and they originally, their lease on their vehicles was up on May 1st, but apparently something happened along the way, so they wanted the vehicles a little bit early, so they sent a request to us in March, and we processed the paperwork and got it to the board, and so this is the soonest we could get it to the board, so it's
Okay.
effective today.
Anything further, board? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. And the next one?
The amendment to the county critical incident policy, Sandy?
Hey, this is a recommendation of myself, Sandy DeHaat, Human Resource Administrator, with the concurrence of Thomas J. Eigel, County Administrator, to amend the Clermont County Critical Event Policy, Section B, titled Applicable Leave Provisions, to set forth policy in response to the Families First Coronavirus Response Act. Attached thereto, made a part thereof, effective April 1st, and to authorize the Human Resource Department to update appropriate internet links and dependencies accordingly. The amendments with the FFCRA was effective April 1st. So this policy incorporates the emergency paid sick leave and an expanded reason for family medical leave coverage. There are 6 reasons that employees could qualify for the emergency sick leave. It is specific to COVID-19. Some of those reasons are paid at 100% of the employee's regular wage. Other reasons are at 2/3 the pay. This policy allows employees to offset that remaining 1/3 with their own paid sick leave to keep them home. And that's pretty much the gist of it.
Board, you've heard the request to amend the Clermont County event policy. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes.
Thank you.
Thank you, Sandy.
Commissioner, I
Yep.
just want to compliment Sandy on keeping up with this. The
Very
amount of
much so.
information that's coming down from the federal government and state government regarding personnel issues and family medical leave, and she stayed right on top of it. So Sandy, thank you so much for doing that.
Thanks, Sandy.
Thank you, Sandy.
Anything further, Tom?
No, sir.
All right. Then I would request that we move to executive session pursuant to Section 121.22 G1 and G3 of the Ohio Revised Code to first consider the employment or compensation of one or more public employees, and second, to confer with the prosecuting attorney regarding pending or imminent litigation, respectively. Do I have a motion to move to executive session?
I'll make the motion.
Second.
It's been moved and received a second. Roll call, Judy?
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes, we will move to executive session. We will return and we will conduct further business. Thank you. We have returned from executive session. There were no actions taken and no decisions made, and we will proceed on with the agenda as presented. Tom, do we have any additional add-ons to consider today?
We have a table of organizational change with the Department of Job and Family Services for the board's consideration.
Board, you've heard the request to amend the agenda to add a Job and Family Services organizational change. Do I have a motion to amend?
I'll make the motion.
Sorry.
All right.
Claire made the motion. Ed?
A second.
It's been moved and received a second. Roll call, Judy?
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes, it's been added to the agenda. And Mr. Dick, I would assume that you are here to discuss that.
I am. Thank you, Commissioners. It's a recommendation myself, Timothy Dick, Director of Department of Job and Family Services, with the concurrence of Thomas J. Eigel, County Administrator, to adopt a revised table of organization for the Clermont County Department of Job and Family Services as outlined below and in Exhibit A attached thereto and made a part thereof, with said changes resulting in an overall decrease in full-time staffing levels from 217 to 214 full-time employees at an estimated overall cost savings of $86,836, effective upon approval, and further to authorize the update of the appropriate internet links and appendices accordingly. In the Children Protective Services Division, abolish the Social Service Aide 1 position. In the Child Support Enforcement Division, abolish the Fiscal Officer 2 position. In the Public Assistance Division, abolish Income Maintenance Worker 3 full-time position. And add an Income Maintenance Worker 3 part-time intermittent position. And downgrade a DJFS Case Manager Supervisor 2 position to an Administrative Supervisor 3 position.
Board, you've heard the request for an organizational change in the Department of Job and Family Services. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
The effective date is today.
It's, yes. Yes.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Thank you.
Thank you.
Anything else, Tom? Then I would move to H for board member comments. Board, any comments today on today's meeting?
I would just advise everyone to continue to keep ourselves safe and social distance, and if we keep up the fight, we're gonna win.
Absolutely, absolutely. Commissioner Corcoran?
Nothing, sir.
And the only other comment I would touch on today is just a very, very quick one, but to say sincerely, happy birthday, Commissioner Corcoran.
I knew it was going to happen.
That's no problem.
Thank you. It'll be my last birthday. Thank you, everyone.
It will
That'll
not.
be your last one this year.
It
Yes,
will not.
this year. Thank you, Judy.
We're sorry that you're here today, having, to celebrate your birthday.
Is that
At
what you
this
were
desk,
really
you know
meaning
me.
to say? We're sorry
Absolutely.
you're here today?
Well,
Okay.
I'm glad you're here at the desk today.
Oh,
but,
thank you.
I understand that, a lot of times people do celebrate birthdays with special events, and hope you have one tonight and that you get to spend some time with your family doing that.
I hope I do too. In light of things, we're social distancing.
Correct.
Social celebration.
Yes, social
Correct.
celebrating. Thank you.
With that, I would just say thanks for being part of our meeting today, and for those who have tuned in either through Facebook Live or some other social media network, if you see this on the cable channel, we would ask that, keep your safety and your families as a first priority. Continue to follow the COVID-19 guidelines, and we're going to get through this, and we're going to come out all better for it. God bless you and your families. Thank you. See you next week.
Did you want to have a motion to adjourn?
Yes, and I would ask for a motion to adjourn.
I'll make that motion.
Second.
Been moved and received a second. Roll call, Judy?
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. We stand in adjournment. Thank you for watching today.